The ABC15 Health Insider team continuing our team coverage now. The topic of blood clots already on the radar of the medical community, even before today's decision. Doctors say blood clots are also being seen among COVID survivors, even among those who never experienced severe symptoms. Some 850,000 Arizonans have had COVID-19, more than 10% of our population. But even among those who've recovered, doctors recommend being on the lookout for lingering symptoms. Among the most serious, blood clots.
Blood clot can kill you if it's in the right spot. Now, but that's not everyone gets a blood clot, they die. Let me be really clear about that.
Arizona Medical Association President Dr. Ross Goldberg says it's more of a concern for COVID patients who are hospitalized.
Think about what COVID does. COVID causes a large inflammatory reaction in the body, and there seems to be some long-term inflammatory effects that are being occurring.
The Mayo Clinic adds while large clots can cause heart attacks and strokes, much of the heart damage caused by COVID-19 is believed to stem from very small clots that block tiny blood vessels, capillaries in the heart muscle.
I am not advocating for anyone to go home and start taking an aspirin a day or things like that. The at-home people always default by going and talking to your physician.
Your own doctor knows your medical history the best, which is especially helpful because Dr. Goldberg says blood clots don't always come with an obvious, unique warning sign. Finally, if you do suspect a problem, don't let it linger.
Living a healthy lifestyle is the best thing you can do. Being mindful of symptoms and not ignoring them.
Now, in light of today's developments with the J&J vaccine, we checked back in with Dr. Goldberg tonight, asking him specifically about that.
The risk of you getting a blood clot when you have COVID is significantly higher than it is from having the Johnson & Johnson vaccine. It's a higher risk if you're a smoker. It's a higher risk if you're on birth control pills than you would if you got the Johnson & Johnson vaccine.
He says he does support the pause on the J&J rollout to investigate, but hopes we all keep that 6 cases out of nearly 7 million doses number in perspective. If you have a question or a story you want our Health Insider team to look into, just send us an email to healthinsider@abc15.com.